Clinic Health System social worker Phillip Nielsen joins us in studio today to talk about human trafficking of minors. Thank you so much for joining us today. So is this a problem that is occurring in this area, maybe that we don't know about?
I think so. I think, when we take a look at all of the studies nationally and internationally, it's occurring all over the world. Some studies indicate that it's probably a criminal activity, trafficking, second only to human traffic or to drug trafficking. So yes, it's occurring anywhere in the United States. Anywhere from 250,000 to 400,000 children are estimated to be trafficked in the U.S. And then we had the case in 2015 right here in our backyard. So yes, it's happening.
What can people do to kind of help stop the spread of something like this?
Well, when we take a look at who's most likely to be a victim of child trafficking, it's those children who are disengaged from society, who maybe have a history of abuse and neglect. We know that teenage runaways are more vulnerable. They are vulnerable to a number of things, including being trafficked. So increasing awareness, and then learning how to intervene effectively.
How can people learn more about this? I see you have maybe some information there too. So.
Yeah, we have a conference coming up. This is our 20th annual conference on child maltreatment issues. It's a wonderful collaboration between Mayo Health System and a number of community agencies to bring issues about child maltreatment. And I think, when we talk about child human trafficking, being aware that, number one, trafficked victims aren't going to necessarily ask for help. Certainly the people trafficking aren't. And so being aware of the risk factors and then figuring out how do we as a community respond once we identify a potential victim. Our maltreatment conference will have a professional program as well as the evening program.
All right, thank you so much for joining us. We'll be right back.